If you are over 70 years old and your doctor recently gave you a high five for driving your blood pressure down to a perfect 120 over 80, you need to stop what you are doing and listen to me. A massive clinical study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 years, and the results completely destroy everything the medical establishment has been telling us. The men with the so-called perfect blood pressure had a staggering 28% higher risk of suffering a catastrophic fall, and their actual mortality rates were worse than the men with moderately higher numbers. Welcome to the Men's Wellness Blueprint. Today, we are breaking down a highly dangerous medical myth that is costing older men their independence and their lives. I'm going to show you the exact blood pressure range that clinical data proves is associated with the longest survival in men over 75. We will expose exactly why the standard medical target is physically dangerous for an aging male body, and I will give you a simple 3-minute test you can do in your living room tonight to see if your medication is secretly setting you up for a devastating fall. Before we get into the blueprint, go down to the comments right now and type your exact age. Nothing else, just your age. The biology we are discussing changes drastically depending on whether you are 65 or 85. And if you ever feel dizzy when you stand up from a chair, add the word dizzy to your comment. Let me paint a picture of exactly what is happening in doctors' offices every single day. A 78-year-old man walks in. His blood pressure reads 145 over 86. The doctor looks at a computer screen, sees the universal guideline targeting 130 or lower, and instantly writes a prescription. Over the next 6 months, the pills work. The pressure drops to a beautiful 124 over 78. The doctor is thrilled. The patient feels like he is winning. But here is the brutal reality the guidelines ignore. That same man wakes up at 2 in the morning to use the bathroom. When he stands up, his blood pressure instantly plummets from 124 over 78 down to 88 over 56. His brain is suddenly starved of oxygenated blood. The room spins. He misses the door frame and hits the floor. Now, we are no longer talking about a blood pressure chart. We are talking about a shattered hip, a massive surgery, and a permanent loss of physical independence. This happens because the medical system operates on a highly flawed assumption that lowering blood pressure is always better. If you are a 45-year-old man, driving your blood pressure down aggressively prevents heart attacks and strokes. The science is absolute. But when you cross the age of 75, your biological machine fundamentally changes. The JMA internal medicine study proved that seniors with a systolic blood pressure between 130 and 140 actually live longer than those forced below 120. The group with a perfect 120 over 80 suffered massive rates of fainting, acute kidney injury, and an overall mortality rate 14% higher than the moderate group. Why does this happen? Your cardiovascular system at 75 is not just an older version of what you had at 40. It operates differently. There are 3 massive physiological shifts. First, arterial stiffness. As you age, your arteries lose their elasticity. Think of a stiff old garden hose compared to a brand new, flexible one. When your heart pumps blood into stiff arteries, they cannot expand. Therefore, your body physically requires a slightly higher baseline pressure just to force adequate blood flow up to your brain and into your kidneys, especially when you are standing up fighting gravity. Second, sluggish baroreceptors. Baroreceptors are microscopic sensors in your blood vessels that detect pressure changes. When a younger man stands up, these sensors fire in milliseconds, constricting blood vessels to keep the pressure stable. In older men, these sensors become dull and slow. If your baseline blood pressure is chemically forced too low by medication and your sensors are slow to react, standing up causes a massive, dangerous drop in pressure. This is called orthostatic hypotension. Third, metabolic clearance. Your aging liver and kidneys do not clear medications out of your blood as fast as they used to. A standard dose of a blood pressure pill can build up in an older man's system, hitting his body much harder and driving his pressure dangerously low. Here is the blueprint to protect yourself. I'm going to teach you how to perform orthostatic vital sign measurement at home. Most doctors completely skip this test, but it is an absolute lifesaver. You need a standard $30 digital blood pressure cuff. Step 1. Lie completely flat on your bed for 5 straight minutes. Do not move. After 5 minutes, take your blood pressure while still lying down. Write down both the systolic and diastolic numbers. Step 2. Stand up immediately. Do not wait. The exact second you are vertical, take your blood pressure again. Write those numbers down. Step 3. Do the math. If your top number drops by more than 20 points, or your bottom number drops by more than 10 points when you stand, you are in the danger zone. You have orthostatic hypotension. If your lying blood pressure looks like a perfect 125/78, but it crashes to 98/64 when you stand, your brain is suffocating when you are vertical. Your medication is likely too aggressive for your age. So, what should your numbers actually be? Remember, this is an educational blueprint, not personal medical advice, but here is what the clinical data supports. For a relatively healthy man between 65 and 74, a systolic range of 130 to 140 is optimal. It protects the heart while ensuring heavy blood flow to the organs. For a man between 75 and 84, the target shifts higher. Research supports a systolic range of 135 to 145. This accounts for the stiff arteries. For men over 85, a systolic range of 140 to 150 is often appropriate to prioritize fall prevention over aggressive cardiovascular control. As for the bottom number, the diastolic, it should generally stay between 70 and 85. If your diastolic drops below 60, you are severely reducing blood flow to your actual heart muscle, which is highly dangerous. You need to understand why your doctor probably has not told you this. The medical system moves incredibly slowly. The guidelines telling doctors to aim for 120/80 were built on trials using middle-aged men. The medical system lazily applied those exact same rules to 80-year-olds. Doctors are trained to look at a number on a chart and fix it. In a rushed 15-minute appointment, they do not have the time to evaluate your orthostatic drop or individualize your care. They are treating a number, not the man sitting in front of them. You must become the CEO of your own health. If you are over 70, start taking your blood pressure at home, both sitting and standing. Do not just accept a blanket statement that you need to be at 120/80. Walk into your next appointment with your exact numbers and ask your doctor if your target is actually appropriate for a man your age. Ask if your medication is putting you at risk for a fall. If this unvarnished, hard truth gave you the clarity you need to protect your independence, hit the subscribe button right now. We are building a brotherhood of men who refuse to blindly follow a broken system. We drop elite-level, science-backed strategies every single week to keep you strong, sharp, and entirely in control of your health. Drop a comment below and tell me if you have ever felt dizzy after standing up. Share this video with a brother or a father who is popping blood pressure pills every morning. You might just save him from a broken hip. Keep demanding better, keep building your blueprint, and I will see you in the next video.